Okay, so let's talk about scarring after surgery. There are going to be things I do in surgery to set you up for having the best possible scar. And then there's other factors that I can't control and you can't control, like genetics, for example. But there is a whole list of things that are under your control after surgery. And I like to do all of these things so that we give you the best result possible. In surgery, for example, I will use sutures that will minimize the degree of inflammation created, and that contributes to scarring as well. And I'll also do the placement of even the stitches in a certain way to minimize tension, even designing the scar very intentionally to one, hide the position of it, but also do it in a way that minimizes scars that have more tension on them. They tend to be wider or more raised. So all of these things are factors I kind of consider in the planning for the surgical technique. And then your part comes into play. So after surgery, I'm going to give very specific postoperative instructions. They're designed to help you get the best result possible. So, some things are hard for patients, like not working out for 6 weeks for most of our surgeries, but also the step-by-step instructions I give for optimizing that scar are going to include things like scar therapy during the postoperative period. It can be a scar gel, it can be silicone sheeting, it can be other devices that take tension off of the incision. A combination of these things, especially for patients who have a history of poor scarring, I like to keep an eye on that early. And that might mean we need to do something like small interventions, like a steroid injection, for example. If I see you early and can kind of manage and guide that scar, I feel like we have the best chance of getting the least visibility of that scar. And then there are also going to be other things that we like to bundle into our postoperative care. So things like microneedling or laser resurfacing, anything I can do to kind of erase that scar. So in the end, I want that contour to be as beautiful as possible, but also the least visibility for your scar.